This is a mock health assessment for a nursing program. Hi Natalie, my name's Larissa. I'll be your nurse today. How are you?
Good, how are you?
Good. I am going to be doing your assessment. Are you ready?
I'm ready.
What brought you into the clinic today?
I just need a general physical done.
Okay, I will be more than happy to do that for you. First, I wanted to start off with getting some background information before we actually do the physical exam, if that's okay. First, do you have any chronic illnesses such as asthma?
No.
Diabetes?
No.
Hypertension?
No.
Any seizure disorders?
No.
Okay. Any other issues that you have going on that you maybe want to tell me about?
No.
Okay. Are you currently taking any prescription medication?
No, I'm not.
Okay. Do you take supplements or vitamins?
No.
Okay, so nothing over the counter?
No.
Okay. And how about allergies? Do you have...
I do have allergies, seasonal allergies.
Okay.
And I do take medicine for that.
Okay. What are your symptoms?
Itchy, watery eyes, runny nose, sneezing, sometimes coughing.
Okay. And what do you take?
Over-the-counter Zyrtec.
Do you take it daily or
Yes.
how often?
Once a day, it's 24 hours.
Okay. And when's the last time you took a dose?
This morning.
Okay. And so it's just seasonal, not year-round.
Right.
24 hours. Do you have any allergies to latex?
No.
Food?
No.
Okay. Now I just want to get a little bit of past health history information.
Okay.
When you were a child, did you either have measles or mumps or rubella?
No, but I had the vaccine.
Okay. And do you know what year?
Probably early elementary, so 95.
Okay. And how about the flu?
I didn't have the flu as a child, but I've had it as an adult.
Okay. When's the last time that you had the flu?
Last year.
Okay. Have you ever had the flu vaccine?
Yes.
Okay. And when did you have that?
Last year as well.
Okay. How about chicken pox? Have you?
I've had chicken pox, and that was early childhood, and I've had the vaccine.
Oh, okay. When did you have the vaccine?
Probably 97.
Okay.
So after I had the chicken pox, I believe.
Okay. Did you ever have pertussis when you were a child?
Not that I'm aware of.
Okay. And let's go further into vaccines. Have you ever had the vaccine for hepatitis A?
No.
Hepatitis B?
Yes.
Do you remember what year that was?
Probably 2007.
2007. Okay. How about HPV?
Yes.
Okay. And what year?
2007.
Okay. Tetanus is another big one.
Yes. And that one might have been for high school, so 2005.
Okay.
Around that.
Do you have a history of any throat infections?
No.
Ear infections?
No.
Okay. So generally healthy?
Yes.
Okay. Have you ever been hospitalized?
No.
Okay. Have you ever had any surgeries?
Wisdom teeth extraction.
And what year was that?
2007.
Okay. And how was the outcome?
It was routine. Everything was fine. No complications.
And your mouth feels better now?
Yeah.
How about, when was your last prior physical?
Probably 2011.
Okay. And everything was normal?
Everything was normal. Fine.
Good.
Just general checkup kind of thing.
Okay. About what we're going to do today. What about your last eye exam?
Last year, and everything was fine. No changes.
Okay. So do you wear contacts or glasses?
I have glasses, but I only use them when I need to read something further distance.
Okay, like the board?
Yeah.
Okay. And when was your last dental exam?
Earlier this year, and everything was fine.
Okay, so you brush your teeth, floss regularly?
Yes.
Okay, good. When was your last pap smear?
Last year.
Okay. So 2013?
Yes.
Okay, and was everything normal?
Everything was normal.
Okay. And how about your last menstrual period?
2 weeks ago.
Okay. Have you ever been pregnant?
No.
Okay. All right. Now I want to ask some questions about your family history for if you have any risk factors. Tell me about the health of your mom.
My mom's perfectly healthy. No health problems or anything.
And how old is she?
She's 61.
Okay. And how about your father?
My dad is a diabetic, and he's 63, but other than that, everything's fine.
Okay, so he doesn't have any complications.
No.
Good. Do you have any siblings?
No, I'm an only child.
Okay. And tell me about the health of your mother's parents.
My grandfather passed away in his late 80s from a heart attack, but he also had Alzheimer's.
Okay.
And her mother passed away probably late 70s, and she died of a brain tumor.
Okay. And how old was your grandfather?
He was in late 80s. I think he was almost 90, so 89 actually.
Okay. Okay. And grandmother?
I was young, so late 70s, mid 70s, somewhere in there.
And how about your father's parents?
My grandfather passed away with, he died of lung cancer.
Okay.
And my grandmother, she has breast cancer, Alzheimer's, and diabetes.
And she's still currently living?
Yes.
Okay. And about how old is she?
Late 80s.
Okay. And do you remember how old your grandfather was?
I'm gonna say he was in his 70s.
Is there any other family history that I should be aware of on either your aunts and uncles on your mom or on your dad's side?
No.
Okay. And what do you do for fun? What are your hobbies right now?
Just going to the gym, hanging out with friends, reading.
Okay. So you enjoy exercising?
I do.
Okay. Tell me about your typical routines.
I have a trainer that I see 3 times a week, and I run.
Very good. And are you currently working?
I'm a student.
Okay. And what's your major?
Nursing. I'm a nursing student.
Congratulations.
Thank you.
Is that stressful for you?
Very stressful.
So just what do you do to help alleviate the stress?
So working out.
Good. And how close are you with your family?
Very close.
Good. So you see them regularly?
They live out of town, so I see them as often as possible.
And how about your nutrition status? What is your typical diet?
I'm a pescatarian, so I eat fish, vegetables, fruits.
So pretty healthy.
Pretty healthy.
Has any of your cravings changed with being in school? Have you lost any weight? Is everything?
No, not recently. I haven't fluctuated anything. So.
Well, that's good. And do you use tobacco? I know you said that your grandfather smoked, so.
I do not.
Okay, good. Do you consume alcoholic beverages?
I do, socially, not regularly.
Do you weekly or bi-weekly?
Probably more bi-weekly on the weekend sort of thing.
Okay, so socially. And do you use any illicit drugs?
No.
Okay, good. All right, is there anything else that I should be aware of or anything else that you want to talk to me about?
No, I think that covers it.
Okay, so your stress level's a little high right now, but how about your anxiety levels?
Right now, since it's summer, it's fine, but give me a couple months.
Okay, just want to assess your mood. And now we can begin with the physical exam if you're ready. All right. I'm going to start with your hands.
Okay.
First, I'll assess that your skin is warm and dry, which is good. I'm going to check your perfusion by pressing down on your fingernails, and it is good. It comes back immediately. I'm going to check your skin and pull up on it, its turgor, to see how hydrated you are, which it goes back down normally, so that is good. I'm checking your fingers for clubbing. That can be a sign of cardiovascular disease and issues and respiratory problems. I'm checking your skin. I see that you have a lot of moles. And freckles. Do you like being out in the sun?
I do.
Do you wear sunscreen?
I do.
Good. Do you use tanning beds?
Yes.
Shouldn't be doing that. I'm just kidding. I'm checking your moles for the area. The borders are regular, which is good. I'm checking the diameter, the color, which is brown, no uneven coloring or color changes. And I'm checking the elevation, which they are all flat. Have you noticed any changes in any of your freckles or moles?
No, I have not.
Okay. Now I'm going to assess your radial pulses on both hands.
Okay.
They are both strong, and I would rate them at a 3.
Okay.
Now I will check your brachial pulse. Which is normal and strong. And I will check your other brachial pulse. Which is normal and strong. I would rate them both at a 3.
Okay.
Now I'm just going to touch your scalp. Make sure that everything is normal, not overly dry. Nothing else going on. Your hair is not overly dry or breaking, which is good. And now I'm going to start looking in your eyes and checking your pupils for constriction.
Okay.
And making sure that they are equal, which is good. Good. They both constricted. Now I'm going to check up your nose and check in your ears. And now if you can open up your mouth, I'm going to check to make sure that your mucous membranes are pink and that you are hydrated. How about you stick out your, good, and stick out your tongue. Good, and your teeth look good as well. Now I'm going to touch your neck and palpate down to your clavicle.
Okay.
Just checking for any lumps or anything that should not be there. And everything feels good. And check your carotid pulse. Feels good. Other carotid pulse. Feels good. I rate them both at a 3. And now I'm going to check your blood pressure.
Okay.
Blood pressure was good. It was 110/75. And now I'm assessing your rate and depth of breathing. If you'll just breathe normally. Looks good. Deep breaths. You're not having any problems with breathing. Your anterior and posterior chest ratio looks normal. I'm going to assess your costal angle, making sure that it is less than 90 degrees. And now I'm going to check for excursion on your back. If you can take a deep breath in and let it out. Both sides are symmetrical. That is good. Now I'm going to check your costovertebral angle tenderness. So tell me if you have any pain. This is assessing your kidneys.
No, no pain.
And this side?
No.
Good. Now I'm going to check your tactile firmitas. Every time I place my hands on you, if you can say 99.
99.
Good vibrations.
99.
Good vibrations.
99.
And now I'm going to check it on the anterior of your chest as well.
99. 99. 99.
Good. Symmetrical vibrations on both sides, so that is healthy. And now I'm going to check your esophagus. If you can say E.
E. E. E. E.
And they are normal sounds. And now I'm going to listen to your lungs and your heart. First, I'm going to start with bronchial. No adventitious bronchial breath sounds. I'm listening for bronchiovesicular breath sounds. And now I'm listening to vesicular breath sounds. No adventitious sounds. Now I'm going to listen to your heart. I'm going to find your angle of Louis, just right here, and move over to your second intercostal space. Listening to the aortic valve. Pulmonary. Erb's point. Tricuspid. And mitral. Everything sounds normal. Now if you can lay down on your back, and I'm going to listen to the sounds of your abdomen. I'm going to start with your upper right quadrant, upper left quadrant, lower left quadrant, lower right quadrant, and everything sounds normal. Do you have any tenderness or any sort of pain in your abdomen?
No.
Okay, I'm just going to touch lightly. Feel for everything. And everything feels normal. If you can sit back up. And I'm going to check your reflex. If you can sit back a little bit so your feet are not on the ground. Normal. Normal. And now I'm going to check your popliteal pulse.
Okay.
Give it a 3, nice and strong. Check it on the other side. And I'm going to check your dorsalis pedis. Posterior tibialis. They're both good and strong, rated at a 3. And checking the other sides. Again, both strong, rated at a 3. All right.